Hi, everyone. This is Jeannie White, station manager and host at Passionate World Radio, and my show is called Social Connections. And now we're doing this segment called Whine Cheese, which I think is a very important segment. It's a place for people to come and vent a little bit. Maybe there's something bothering you or you want to state it. But today I have Ms. Mary Coughlin, and I want to welcome you, Mary, to the show.
Thank you very much, Jeannie. I'm wicked excited to be here.
Yes. And then you can just, go, whatever you want to talk about, Mary, it's up to you. All right?
Okay.
You get the phone.
All right. I'm on. Okay. Well, the thing I really wanted to whine about is this struggle that bedside nurses have around missed care. Missed care is care that is left undone at the end of the shift because we just work in these, crazy, hectic environments, and our patients are very, very sick, and it's really, really a challenge. Not just in my specialty, which is neonatology, but this has been a phenomenon identified across all the different areas of nursing, where nurses come on shift, you get your patient assignment, and you just go through this subconscious prioritization based on the needs of the patient at that time, and unfortunately there are just some things that just don't get done. And as I whine about this, I'm not whining about this in reference to my colleagues. My heart breaks for my colleagues who struggle to try and get everything done and meet the needs of these incredibly vulnerable individuals. I really am cross with the current way our healthcare system operationalizes the real talents of nursing. That when you look at how nursing care is costed at the hospital level, the cost of nursing services are bundled into the price of the bed. There's no real way of capturing and quantifying the magnitude of the work that a nurse brings to the patient's experience. And so, you're so challenged then to get all of that stuff in place, where these, organizations are cutting back, there's layoffs, there's never enough staff. And one of the things that I uncovered, as I was really trying to get a handle on this idea, is that the biggest contributor to missed care is indeed not the bedside nurse, but the system in which they work. That it's really about the professional work environment. And my big gripe is that when will the healthcare industry wake up and realize that these individuals, they come to the hospital because they need 24-hour nursing care. It really doesn't, certainly they're sick and stuff, but that's the thing that then prompts them to need that continuous professional assessment, management, nurturing, caring, compassion that helps bring that individual from that point of sickness, hopefully to a place of recovery, or at least resolution of what their original diagnosis is. So my big gripe is that we, as a healthcare industry, and I think it's a national phenomenon, that we just don't really value what nursing brings to the plate. There are some folks that have looked at this idea of value-based nursing and trying to unbundle nursing from the price of the bed and really separate it out so that we can really quantify and qualify what is good nursing and link these specific excellent practices to patient recovery and patient satisfaction and all those kinds of things. But until we wake up, and start really looking at the quality of the nursing care and meeting the needs of the nurse to provide the best care that she can for the patient, then we're just going to continue to struggle. And when you look at where we are as a country ranked in healthcare across the planet, it's pretty embarrassing. We're, some people think we're number one. We're like almost 40 on the list of the quality of healthcare in the world. And that to me, that's embarrassing. We're supposed to be this big, wealthy country, and we have like over 3 million nurses in this country. Why can't we honor the good work that they do and create environments where they can really optimize and just transform the patient's experience of care in a meaningful, measurable way that makes a big difference? So, that's my whine.
Well, thank you, Mary. That was very good. Honestly, I mean, and then way down the road, you may be able to find a solution for someone on this down the road. You never know. But at least you bring it to someone's attention, and that's what this is all about. This little segment is to bring things to attention. So I want to thank you, Mary, for being on at Whine Cheese, and I want to thank everyone for listening. This is Jeannie White from Passionate World Radio Network. I am the station manager and the host. So if you have any comments or questions, you can contact me at jwhite7033@comcast.net, and I will relay it to Mary if you have a question for Mary. All right. Again, thank you everyone for listening. I hope everyone has a good day, and see you on the radio. Bye now.